Now we will go into the practice of Kapalabhathi Kriya. Some call this as part of Kriyas, some call this as Pranayama. What is the difference? Kriyas are cleansing techniques adopted in yogic parlor. There are 6 Kriyas mentioned in Hatha Yoga Pratipika. Out of those 6, Kapalabhati is one. The other 5 being cleaning of the nasal passage with water and cleaning between the nasal passage and throat. Second, between throat and stomach cleaning. Third, between stomach and the anus, that is that intestine area cleaning. That is 4. And then you have cleaning for the eyes and for the Kapala. So totally 6 areas which we attempt to clean by the Shat Kriyas. Kapalabhati is one among those 6 Kriyas mentioned in that earliest literatures on yoga, Hatha Yoga Pratipika. Now, what is the part that this Kapalabhati clean? It is the sinus pores and the nasal passage. It completely clears these passages. That means your breathing will be smoother, easier, and obstruction free on continued practice of this Kapalabhati Kriya. There are certain restrictions because not all people can do this exercise. For instance, women are advised not to attempt this Kapalabhati Kriya. There are reasons behind telling this. That is, this forceful exhalation nature involved in this Kriya might, for some people, produce the prolapse of the abdominal organs, including the uterus. So it is not recommended for women in that sensitive period of time and during pregnancy, that entire period of pregnancy, to avoid this pranayama exercise fully. Others can do it, but limit it to about 15 times maximum breathing. Even among men, it is not recommended for those having problems in the eye or ear region, any type of problem in this region, or if you have a tendency to bleed in the nose on vigorous exercises. Some people do have that kind of a tendency to blood will slightly ooze out when you do vigorous exercise. Such people should avoid it. And those suffering from blood pressure, high or low, also should avoid doing this exercise. This exercise has to be performed only on an empty stomach. After emptying your urinary bladder and the bowels. Stomach should be kept as far as possible empty when you do this exercise. In case you are advised against keeping it empty on vigorous exercises times, you may take a glass of water or milk or fruit juice, not more than that, and then do the exercise. Now we will go into the practice straight away. Just observe passive inhalation, active exhalation. That is, inhalation is slow and steady, and exhalation is forceful. Our focus is on expelling the air forcefully, like this. Sometimes the flapping of the muscles of abdomen also take place when you forcefully breathe out. First observe, I will do a few breathings and then focus it on my stomach. Okay, let me start. Relax. I will now focus on my stomach. You please observe. Relax. That was Kapalabhathi Kriya.